we're going to shift now into, when you're starting to get treatment, and I know you
Mhm.
transferred to a bigger hospital. Did you ever consider getting a second opinion? I mean,
Yeah, I ended up going to the bigger hospital. He was a hematologist oncologist.
okay.
And at that point, I was so sick that it wasn't even in my mind to get a second opinion. It was, I just want to get better. I just want to get to a place where I feel better.
Mm.
And that was kind of where I was.
Yeah.
There really wasn't, for me, there really wasn't any time to process. It was, I honestly, at the time when I went into the hospital, I really felt that I was dying in every way. And so when they were getting to the treatment part and me to feel better, that was more, I think that was more of what I was looking for. Is I just wanted to feel better. And I had felt so lousy for so long that I just wanted to feel better. And if he said he could make me feel better, I was just going to trust him. And so at that point, I never thought about getting a second opinion at all. At that point, I just wanted to be treated so I could get better.
Oh, absolutely. I mean, at this point, you've been dealing with symptoms for a year, and
Mhm.
that's incredible to me. And I guess that really was a decision between, so the first place you were, they did send you to a bigger hospital because it was like,
Yeah,
you need to see someone who specializes in this, right?
yeah,
At least,
exactly.
at least a hematologist who knows about blood cancers and not a general oncologist.
Yeah.
Um, Perfect. And then I know you were released to go home. Well, first, I guess with COVID, is there any sort of summary in terms of, you had mentioned you couldn't go to any cancer centers because of the COVID. So
Mhm.
um, you wanted to just get treated. This was the hospital to go to, but did COVID impact anything else for you in that time?
Yeah, I was on the oncology floor. And so because I kept on having chest pains. And so they were like, well, let's just test her one more time for COVID since it had been several days since I had been tested. And so I did. And I think it was 7 days after I had been in the hospital. So, or after I had been exposed. So immediately I have to go into quarantine. And so they put me on the COVID floor to finish my treatments. Cause once you start your treatment, you have to do it on day 1, day 3, day 5, day 8, all of that. And all of that would have put me where I wouldn't have been able to get treatment. And therefore I wouldn't have gotten better. So their solution was, we're just going to keep you. And so they did.
Thank you for sharing that, Marty. I do want to shift now to, you're talking about this treatment. And
Mm-hmm.
so, um, and let's see, so the treatment was the chemo, and it was a weekly bortezomib or Velcade,
Mm-hmm.
daratumumab or Darzalex, and lenalidomide or Revlimid, just so people, because they hear all the different,
Right.
whether it's the trade name or not. And can you describe that regimen, what that was? Were you in the hospital, I mean, for the entire time? And how many days on, how many days off? It'd be great to know that.
They did that as an IV treatment for the first one. At that point, I didn't care what they were giving me. So we did that. And then once I was released and I was better from COVID, I could go to the cancer center. And so I did a weekly shot and then a Velcade. And then they did, is it Zomafed? Is that where it's for your bones? Yeah. So they gave me that treatment also. And then I did a couple of rounds of the Velcade. I think I did one cycle of Velcade, which is 4 weeks. And then I started the DARS, they call it DAR.
Dartumimab. Yeah.
Yeah, daratumumab. That's it.
I,
And that one, I went down to the bigger hospital, the bigger cancer center, because they had a bigger staff. And that one is another, the first IV treatment of that. Usually they just like to keep a very close eye on you, so that you don't have any reactions to that. And so, and I am one of those people that I did have a reaction to it. So I ended up having to spend 2 treatments down there, 2 weeks in a row, and in the bigger hospital, having an 8-hour IV both times of that. So, but that was probably the most effective in bringing my numbers back into balance. Everything was working. And as I went through treatment, I have to say, for me personally, I started to feel better because I had been so sick. I just started to feel better. I started to have more energy. I started to feel more like myself physically, where before it was hard for me to function in everyday life. It had been rough there for several months.
no, it's the relief because it was the actual multiple myeloma, the cancer that was giving you all these pains. And thankfully the
Mhm.
medications are, starting to help you with that. And with the bone medication, was it Zometa?
Yes, that's it. Zometa. That's
Okay.
right.
Yeah, I might be butchering the name, but I just want to make sure we got that in there because I know that's something that people take. Some of this, like the biphosphonates or whatever, it could be a different brand. But I love that you're like, they just say DAR. I mean, there's so much medical jargon involved. And I think part of that overwhelms, right? It's like,
Exactly.
who's coming up with these names? Like, let's talk to that person. Like, well, what I'd love is for you to talk about the side effects. And I know sometimes it's hard to figure out what exactly is causing what, but if you could sort of, go through the different, you're on this 3-drug regimen. If
Mhm.
you could kind of do your best to
Mhm.
tell us what you think was related to what. And then in terms of the side effects, what helped you manage
Mhm.
them or deal with them?
Right. My treatment day was on Thursday. And so I would go in and I would get the Darzalex every Thursday, and I'd have a Velcade shot. And then they also do steroids on that day also. And then if it was time for the Zometa, that was the day that I would do the Zometa too. So usually Friday with the steroids, I'd be pretty wound and ready to go almost all evening, with not a lot of sleep that night, and then into Friday. And then usually by Friday night, I would start getting neck pain, and it would just felt like everything was swollen, and it would start right there in my neck. So how I resolved that was I just used a heating pad, and I made sure I took, they advised Claritin because it's an anti-inflammatory. And so I took Claritin, and then I would take Tylenol. Those were the things that helped my side effects. And that would go through until about Sunday is when I would have those side effects. And those are the things that I would do. And then the fatigue, you have all the aches and the pains in your body with that and with all of that. So usually one of those days, mainly Sunday, would be just a rest day for me. And I did not feel bad at all about it. I would go ahead and just lay and watch my iPad, or just where really wouldn't have to think, but I could just let my body rest.
I am so glad that you said that. Like, and I rested on Sunday and I did not feel bad about that.
Mhm.
'Cause maybe to outsiders, it feels like, well, of course, yeah, you should be resting. But I mean, it resonates with me because I would not only feel fatigued, I would rest, but then feel guilty about it. Like, oh, I
Mhm.
didn't do anything, or, and it just makes it a lot worse. And
Mhm.
so, is there anything else you want to add about that? A message for people about, taking it easy on themselves, because obviously your body is going through so much, not with just the cancer itself, but then also with the treatment.
Yeah, I think I want to encourage people to go ahead and not feel guilt or shame for laying down and resting. Your body takes a lot of your energy to heal. And if you can get to a place mentally where you say, you know what, this is what it is my job right now, is to heal. And it is what I'm supposed to be doing right now. Then for me, that helped really good. I'm also on the other side of I'm an empty nester. I do not have small children in my home, and I don't have to have that constant care of children. So for me, that was something that I could do. I've seen other where they are parents of small children and they're not always able to do that. But if a family member could come alongside, or a really good friend, for those few hours and just say, I need a little bit of time. And I hope that people have that support system to be able to do that. I hope that they do.
Yeah, me
But
too.
it is definitely important not to have the guilt or the shame for laying down and letting your body heal.
Take that time. But that's another great point that you're bringing up, which is the importance of caregivers, not just immediate caregivers, but when people are asking, especially in the beginning, when they find out, oh my gosh, how can I help? That's a very big topic. And that's one of them. It's like very specific, like childcare, right?
Mm-hmm.
Okay, so you're going through that. Were there any other side effects or tips that you had for people?
The other side effects didn't really happen. I went through treatment from November all the way until February. And then in February, my white counts began to drop. And then fatigue came with that. Back to the extreme fatigue, not just the little bit of the fatigue from the treatments. It was more where I would sometimes be down for a few days because of the fatigue. So at that point, we went ahead and doctor went ahead and we stopped all treatment just for my body to rest for a little bit and regroup. And so I would encourage people to know that that's kind of part of the normal, and it's not anything to be concerned about. My numbers were really good at that time too. So it was okay for me to take a rest.
I know, speaking of numbers, by the way, that when you were diagnosed, it was stage 3 with the genetic factor 1Q. Of course, I hope people know that the staging is different when it comes to blood cancers and with multiple myeloma, different than solid tumors.
Mhm.
It's not the same. But when your doctor was telling you about the specifics of your diagnosis, did he or she say anything about how your staging or the genetic factor would impact the treatment?
The genetic factor just made me have to change medication. I think I was on an oral medication at first, and that was the only difference with that is it made me switch over to Velcade, to the shot, because it was more effective with that genetic issue. And so that was really just the change. I was still going to have to be on Revlimid, and I did a 14-day on versus and a 7-day off with the Revlimid. And so otherwise they still would have done all the treatments that they did. They just changed that one oral medication to be able to fight the cancer better.
Perfect. And the monitoring, how did they, it was just monitoring your blood levels and the
Mhm.
different.
Every week I just had my blood levels drawn, mainly the CBC, the normal blood work, just to make sure that my white counts, my platelets, and my hemoglobin was normal. And then once a month they would do the light chains, the bigger draws of blood for all of the. I know that they have a name for it. I'm drawing a blank on what that is.
That's
Kind
okay.
of like the medications. It's like, why do you call it that?
Exactly. let's just make it easier for us to be able to talk about it. That's part of it, right?
Exactly.